Hi guys, welcome back to Sadok Health. My name is Dr. Dan and I'm here with my colleague Dr. Job Odoch. So today's video is sponsored by Radiant Group of Hospitals. This is a hospital that is located within Nairobi, has about 7 branches within Nairobi. They offer general medicine, general surgery and special clinics. They also offer isolation and treatment of COVID patients. So today we're going to talk about COVID-19. So as we have seen, the positivity rate is actually going high of late. I think it's now at about 10 and above. Okay? So we wanted to know, as a doctor, what are your personal experiences? How were you able to go through the previous lockdown, the measures you took, the kind of treatments you are giving to the patients, and much more than that on this next video. You ought to know your health.
As you all know, COVID-19 shocked the world. Something that started all of a sudden in China, and we never knew that it would reach as far as East Africa.
Yeah.
Okay? So definitely initially, no one was prepared to handle COVID-19. But then later, as things went on, a lot of things were put in place. As a doctor, from my personal experience, a lot of things had to come in. Okay? Things that we didn't know, things that we had to put in place to ensure that we as medical practitioners are safe and the patients we are handling are safe too.
So, doctor, how did you feel when you were handling your first patient? How were the nerves of you managing this life-threatening disease? You know, how did you feel as a doctor?
Okay, it was really a very tense moment. Despite the fact that I had handled infectious diseases before, Rift Valley fever, Ebola, but COVID-19 really was very scary. Something that is spread by air, contact. It was scary. I remember the first time I handled a COVID patient, a confirmed patient, not a suspect. Putting on that hazmat suit, it wasn't easy. Definitely you sweat a lot, but at the end of the day, any mistake made, definitely you are exposing everyone. It went on, but it was terrifying, I can say. And that's helped me set the pace for the next patients that I would handle. Okay. But it gave me an idea of what can I do to take care of myself. And that is where getting information from the right sources came in, doctor. I believe you yourself, as a doctor, you went through a lot of changes, a lot of modification of lifestyle, of habits, and all that. Yes.
All right. So I'm quite intrigued. I wanted to know, did the pandemic change your lifestyle? Did you find yourself probably spending more money? Mm-hmm. Did you find yourself maybe changing a particular dress code? Maybe you find yourself you're putting maybe a particular clothes, you can't go to hospital this way. How did it really impact your social life?
Personally, a lot of things that I did myself, because from the reading, from the research, friends in the diaspora, friends outside this country who had experienced the disease already, we were consulting and saying this and this. So one thing that I realized first was the fact that to beat this disease, the body has to be prepared. Okay? Mentally, physically, and emotionally. I realized that even when I was working out, I needed to do it better this time round. Of course, gyms were locked. I ended up getting equipment at home, dumbbells, barbells, and I would exercise every moment. My nutrition improved because at that time I knew the body needed healthy foods, fresh foods, fruits, vegetables. I started making a lot of fruit juices. An example of like banana, oranges, pineapples, avocado and the like, I would actually blend and take without sugar. Fresh fruits, I mean, I am someone who loves legumes, fresh vegetables, and I would never miss a meal. Adequate water. At that time, the idea, and which still stands, warm water would help with the mucosa, the lining of the throat, so that, because that is where the virus definitely settles, it will help wash down the virus, and so that you can pass it out in stool. These are the things I went through, and fortunately, it worked well for me, and I didn't really get the disease. I didn't.
Personally, for me as a doctor, when COVID came in, of course, there was that fear that came in really at the start. Really, I can't tell you that my faith was not shaken a little bit. I'm a Christian, so I energize myself in the Word. So what I did, I trusted God more at that time. So I cannot tell you that I didn't walk without a mask. I put on my mask, as the policy of the government was that by law you had to put on a mask, you had to wash your hands. I did all those things, but it also helped me, to grow deeper and really understand and trust God more in this period of time. I remember a particular time when I saw a patient, and this patient was tested positive. I had seen this patient the day, so one day after I got a bad sore throat.
I think I remember that time.
Yeah. I got a bad sore throat, I got joint pains, I got headache. Something started telling me this is COVID. I just kept energizing myself in God, trusting God, and trust me, the symptoms went away. Because a few days later, I tested and I was negative. And I can't tell you it was the first time, it was not the first time. Many times, and to me personally, the only thing I can tell you has done, I've made it through, I think it's been just God. So by the way, if you have experience going through this COVID pandemic, probably a family member or personally you went through it, you can drop your experience in the comments below so that we can know how you went through it. Perhaps it could help someone out there go through it. I believe you have come across a variety of patients of COVID-19. So you've come across stable patients, you've come across very sick patients. The government introduced what we call home-based care. What are the things you look at to send someone to home-based care vis-a-vis hospital management or even ICU care?
What happened is, the disease came in different variants, okay? So the symptoms were different. There are symptoms which are mild, like for a common cold, running nose, maybe a dry cough, maybe sore throat. At certain points, people had tummy aches, diarrhea, vomiting. So what helped us was the severity of the symptoms. There are people that can stay in hospital maybe 1-2 days and go home. Then there are people who didn't have to stay in hospital. You find that when you examine the patient, all the vital signs are normal. We're talking about normal temperature. We're talking about normal blood pressure. The saturation, oxygen saturation is okay. And probably they have just a dry cough, or maybe they just had a sore throat. But of course, taking them to home-based care means following up on them to ensure that they are isolating themselves, even from their family members. They are feeding well, and they are taking the medications we have prescribed. And now, for patients who couldn't go home, these were patients who were shaken. You find that the vital signs are not normal. Temperatures are so high, blood pressures are not behaving well. The saturation, oxygen saturation is below 90. We know that at least 90 is acceptable. And then these are patients who had other complications brought about by COVID. They might have been having a chronic illness, or may have not been having what? A chronic illness. So one thing we always say is, a patient with a chronic illness, be it diabetes, be it hypertension, be it maybe a cancer, as long as they have any serious symptom, that's a patient who doesn't go home. Because things can change anytime. So most times, patients with chronic conditions were being kept in hospital. But depending on how their medical condition, their condition was at that moment. Yeah, and this helped because you remember when everything started, the capacity was not there to handle everyone. So when the home-based care came in, it actually helped a lot because those who didn't have to be in hospital went home and left space for those that really needed the critical care. Since we are looking at an increase in the positivity rate, there are a few tips, personal tips, I want you to give to anyone out there so that they don't fall victim of the disease again. So what are these tips that could help prevent the disease?
So basically, people out there may not really give you any information, as majority of the public, they know the things the government has been talking about. Social distancing, putting on masks, washing hands regularly, sanitizing whenever you can, and of course visiting hospital as soon as you discover that you have any of the symptoms of cough, sore throat, fevers, difficulty breathing, fast breathing, and the likes. Yeah, so basically I would just I would not really differ from what the government says, is that let's try to observe the SOPs that are put in place by the government, because they're our leaders, right? Let's try to do what they're saying, and yeah, also try to be responsible as a person. I don't see any need of, during this time when you're going to a club and, to dance in the night, so just we try just to be responsible as persons.
Personally, like I said from experience and now talking as a doctor, the things that helped me: exercise whenever the chance comes, eat healthy, fresh foods, avoid the junk, okay? Adequate water intake, and then take care of your mental health, avoid the stress. And this is a call actually, because you have to reach out to your neighbor. Definitely a lot of things have happened. Revenue and income, that has gone low. It has affected families, it has affected individuals. So reach out to friends so that we can actually handle the mental health, because realize COVID has come in, a lot of things have been ignored. Very many people have lost loved ones, and now probably they need someone to reach out to them, encourage them. And remember, if we stand by what the government tells us, what the WHO keeps telling us, COVID is going to pass, and we shall thank the Lord, because at the end of the day, like Dr. Dan said, whatever we do, it's definitely God that decides the best for us, and He's always doing the best for us. Yeah. So pray, follow the SOPs, take good care of ourselves, and we shall beat this together. Yeah.
Thank you very much, Doctor. Actually, to hit on the emotional bit of it, you reminded me.
Yeah.
I saw quite a number of patients who were actually okay until you told them they have COVID-19.
Exactly.
If this person has just come in with maybe just some joint pains, you thought it's malaria, then you do the COVID-19 test and it's actually positive. You find this guy's emotions have come down and this guy is worsening. So sometimes it's actually more of the mind. So you need to guard your mind, you need to guard your heart. You need to make sure that your heart and your mind are guarded. So if it's family, you need social support. You need support from everywhere possible. But above all, guard your mind, guard your heart. Thank you for watching this video till the end. I want to thank Radiant for sponsoring this video, for availing such services so that at least the public, where the government facilities were really overwhelmed, the Radiant was there to give a helping hand. If you're new here, don't forget to like, share, and subscribe. Remember, this is a channel that really gives you information about your health. We're trying to make sure that no one is left behind. You really know about your body, you really know about your health, so that you can make a wise decision regarding your health. Sedok Health.
Ask the doctor.